We were just talking a moment ago where you have never had chiropractic care.
Right, I'd never had chiropractic care. I was actually kind of afraid of it.
Scared of the great unknown, or afraid of being hurt or something?
Both, and sort of protective of my back. So I didn't feel comfortable with anyone touching my back.
Right, and because you were in a lot of pain. Why don't you go ahead and tell the story? I mean, you fell off a horse 2 years ago. This is a great story.
Yeah, well, I fell off a horse a couple of years ago, and I broke my back in a couple of places. My L4, my L5. I separated my left shoulder, tore some tendons, and had also injured my coccyx. And so I was in quite a bit of pain, and my doctors told me that would kind of be the case.
Right. Now, the fracture's healed in the spine, and they realized there was no need to do surgery, though.
Right.
Did they... And so you remained in pain even after the fracture healed for months and even years. And you went back and asked the medical doctors, why are you still in pain, and what did they tell you?
Right. Well, they said I was healed, and that I should try and stretch and do yoga and things like that, but I really couldn't do them. And they said that I would likely have some amount of pain for the rest of my life as a result of the injury.
Okay. Did they recommend anything else? I mean, they obviously did not recommend chiropractic to you.
No, that's all they recommended, to walk and to try yoga.
Right.
But I really couldn't do it.
So it was like a one-time visit that you went after a while. Did you go back again to ask them?
I went about 4 times.
About 4 different times? And they gave you the same advice each time?
Yeah, they were like, it looks good. They were pleased with the
healing. Even though you're in a lot of pain.
Right.
And not only pain, but you were in a lot of dysfunction because you were extremely active, not only horseback riding, but...
Right. I was a cyclist. I didn't drive, so I would ride my bike everywhere. I'd swim laps in the ocean and do all kinds of fun things. Hiking, 20-mile hikes just for fun. Right. That kind of thing.
And all of that came to a complete stop?
Complete stop.
And then even again, after the vertebrae healed, the pain was so incredible, and you were probably limited in your mobility.
Right. I didn't go on any walks anymore, which is terrible. Wow. But I just couldn't.
So you went from day to night, extremely active, swimming in the ocean, and no easy feat, folks. Swimming in the Pacific Ocean. I surfed for years. And it's cold and it's rough out there. And so how did you find your way to me?
You were recommended to me very highly by a couple of good friends of mine. And they had been recommending you for some time, and so I finally
came in. Right? You had nothing else to lose. You're already in enough pain and dysfunction.
I really was.
Yeah, and it's amazing how many thousands, if not a couple of million people were in a similar situation as yours. I saw you, 4 weeks ago or so, the very first time. And in your case, I'll keep it super simple. The vertebrae, even though they were healed, of course, in the fracture, they were extremely stuck, compressed together from the fall. The joints, like suction cups that are extremely stuck together, causing a lot of nerve irritation and pain. And after the first adjustment, you probably felt the next few days what?
I actually slept for like 2 days, and then I felt so much better. Well, I felt good after, but I felt better. My boyfriend noticed an improvement. Like, he was really impressed. We've been going on walks since I started every single day.
Wow.
Early morning walks to the point and back. So it's like 2 miles in the morning.
Terrific. And I adjusted you again. And then this is our third time, right? 3 adjustments, that's it. You went from being basically disabled, extreme pain, you're relatively young, to where when you came in today, you said you basically feel no pain.
Right.
And then when I check the areas, it's 90-95% improved, objectively speaking. A little bit of tenderness when I was prodding around. We adjusted you again, and you feel terrific.
Yeah, I'm so happy.
Yeah, good. I'm so happy for you. Completely life-changing. And I'm happy you're sharing this with other people who may have similar situations as yours. Anything else you want to say?
I just said I am super grateful and really happy because this issue affected so many areas of my life. And so it really is life-changing.
Yes. Beautiful. Okay, thanks so much.
Thank you.